The most important part of pediatric care is reminding oneself that you are working with children. You have to be very compassionate, kind, very forgiving, because these are the worst times of their lives, and honestly, they're just kids. And everyone just wants to make a kid feel better.
Our expansion of the Pediatric Services Unit really is just kind of a doubling down on how we are focused on serving our smallest patients.
There's no dollar amount that's going to alleviate inequalities and equities in our area, but the greatest equalizer is access to healthcare.
The ways our unit has changed is pediatrics is very unique that we have such a wide age range that you have to accommodate for, from the infant to the teenager. What this new unit has provided us is the ability to accommodate that in a more holistic approach. It became more of it's not just going to a doctor's office, you are coming in and being cared for like you are entering someone's home.
The unit's expansion was actually mostly funded by state and federal grants, which we're incredibly grateful for. But the Raymus Foundation has partnered with us for the future. Their support of our Deep Roots New Growth campaign to support the medical center is going to help us make sure that we have operating rooms that can serve pediatric patients. It's going to make sure we have the technology and the pediatric specific technology that's going to help us attract those physician specialties who want to care for children. That's something we don't have a lot of access here in Stockton, and because of their commitment to the future of children, we're going to make that happen.
Medicine isn't just big business. The physicians at St. Joe's realize it's a labor of love, and philanthropy is one of the best ways to impact the community. The Raymus Foundation got involved in healthcare, particularly pediatrics, because we have a vested interest in the health of our community. Because anytime you have a neighbor or a family member or a friend that says, I need to take my son or daughter to UCSF, to UC Davis, to Stanford, that's not something we're comfortable with. I want you or I to be able to take our child down the road and get just as quality of healthcare here as you would there. And our belief is if we can help St. Joe's provide the highest quality of equipment and tools, they can provide the highest quality of care.
Our newly upgraded pediatric unit I see as just the start of the investment in our community's future. With the tower coming in 2030, that's going to be more patient supported, more GME programs, and eventually more education in pediatric subspecialties that would be able to support our population.
In local communities, philanthropy is just vital, and it's critical to so many not-for-profits. Yes, St. Joseph's Medical Center, we're part of a large healthcare system, but if it wasn't for philanthropy, there's so many things we couldn't do. It elevates our ability to have the state-of-the-art equipment. And when you have an organization like the Raymus Foundation who gets it, understands their impact, it really allows us to journey together to improve healthcare, not just for the community, but for our friends and family as well.